Hemophilia remains a highly undiagnosed and untreated health condition in Zambia. There's an estimated number of 1,500 people living with this condition across the country. Less than 200 have been captured in the register of the Heamophilia Foundation of Zambia, HFZ, a non-government organization which has partnered with the Ministry of Health and other cooperating partners to fight this condition. More than 1,000 people living with hemophilia remain underdiagnosed and suffer in silence through myths and stigma. But what is hemophilia and what causes it? Dr. Uzima Chirwa is the acting senior registrar at UTH's Children's Hospital in Lusaka. He explains more about this condition.
So hemophilia is a bleeding condition caused by a deficiency of certain factors which are involved in blood clotting whenever someone injures himself. Now, hemophilia is an inherited condition which is inherited from the mother and passed on to the son. So mostly it is the boys who are affected, but in some occasions you may find that girls may be affected. For example, in a condition known as Turner's syndrome. So patients with hemophilia present with easy bruising. They may start as early as birth, or even when they start crawling, you find them bleeding from the joints, or when they have a minor injury, they bleed from that particular injury, and they bleed for a prolonged period of time. So any child that presents with this kind of condition has to be presented to the hospital for evaluation.
The Heamophilia Foundation of Zambia, with its partners, have embarked on a project to help fight hemophilia condition, which saw this building being rehabilitated last year and opened as Hemophilia Treatment Center and the Hematology Ward. The treatment center, which was officially opened by Minister of Health, Chitalu Chilufya, was rehabilitated with support from Novo Nordisk Hemophilia Foundation.
It was registered in the year 2012. It's an organization that was formed by parents who've had a child diagnosed with cancer or life-threatening blood bleeding disorders. Initially, it started as a support group where we actually thought of just coming together as parents to assist one another, especially the psychosocial part. But since inception, we have done a lot. What we are proud to say in terms of the bleeding disorders community, we started with the number 10 for patients around Zambia, but now we are talking of over 150 across Zambia. And then we are trying to make sure that everybody is on prophylactic treatment. And then it has improved a lot of people's lives and their families themselves. A lot have benefited through the support that we are receiving from the World Federation of Hemophilia that have been supporting us in terms of factor, which is administered on the patients, and also the support from our partners like Novo Nordisk Hemophilia Foundation that did the full renovations for the Hemophilia Treatment Center, which is here at A06 at the Children's Wing. So we are actually appealing to the people around across Zambia, those that have suspected people with bleeds, to come out and then have them tested so that we are able to see and then we can help where we can. Because right now, a lot of people, there's stigma around hemophilia from what we've gathered across the country. But we are saying this is not the end of the world. Hemophilia is just a condition like any other condition. And with proper treatment, people living with hemophilia, they live normal lives.
Since its inception, the center has helped a number of people living with this condition. Rose Kalebaila is a caregiver to one of her grandchildren. She says the center is delivering good service to the community.
I'm very appreciative to the foundation because what they've done really is amazing. Thank you very much because just seeing the improvement that has been done, I could even say they've really facilitated the health of the children because it's more organized now. So I say thank you to the foundation Novik and Zambia Heamophilia Foundation.
Maron Kasongo, who hails from Mansa, Luapula Province, and a student at University of Zambia, Unza, is one of the clients at this center.
I can be categorized into one or three things. To begin with, since I was diagnosed with hemophilia, and that was in 2014. In addition to that, I have also come to understand, after mingling with my fellow patients and others, to say hemophilia is just a disease, which is not a case of hindering someone's well-being. Yeah.
In some sections of society, people with hemophilia are being treated as outcasts due to certain myths, misconceptions, and traditional beliefs surrounding this condition. The foundation is worried about this development.
We have had experiences in the past as a foundation where a group of people were being treated like outcasts because of the condition, somewhere in Muchinga province. But I think I would love to appeal to the general community to bring forward those people that are suspected to have bleeding disorders so that they can be on the plan and start receiving the treatment. And then the other appeal is the support for even the community around Zambia. Hemophilia is something that is very expensive, and we need the support. The doctors that are dealing with hemophilia and the medical team, they all need our support, the general support in terms of in any form, because we can't leave everything to the government.
Expectant mothers and children have not been spared from hemophilia condition. This is contributing to maternal mortality in the country. Therefore, women are also being encouraged to go for hemophilia checkups.
In Zambia, we have a lot of these myths where we actually say it's because of the infidelity part, especially during the childbirth. Let us make sure that we have ourselves tested for the bleeding disorders like Van Willebrand's, which is very common. We've lost a lot of lives, and looking at the maternal deaths around, we know that we are losing lives because of bleeding disorders that can be managed.
Chama Mwanga is one of the children who have been diagnosed with hemophilia. At his age, he can now insert the factor on his own. He also attended one of the camps held by HFZ, which is part of the Foundation's outreach programs to create awareness on the hemophilia.
It was the fun we had, and the teaching which they teach us.
Because hemophilia is a bleeding disorder, so people should be observant. One with babies when they begin to crawl, usually they will start seeing uncontrollable bleeding. Just any little noise, they'll bleed uncontrollably. Or when they are cleaning their teeth, they will start bleeding uncontrollably. So once they see that, there is need for them to seek medical attention quickly.
Several medical researchers have recommended male circumcision as one of the interventions to reduce the spread of HIV virus, which causes AIDS, and human papilloma, a virus that causes cervical cancer. And in most cases, bleeding is experienced during circumcision. Government, through the Ministry of Health, working with its stakeholders, has targeted to circumcise 2 million men by 2020, and it is most likely that out of this number, some are suffering from hemophilia. Furthermore, in some parts of the country, circumcision is part of their tradition, and every year, a number of boys are circumcised using traditional methods, raising fear for those that might have the condition. It is for this reason that HFZ has trained a core team in caregiving and treatment with support from Novo Nordisk Hemophilia Foundation and the World Federation of Hemophilia. Those that have received training include doctors, nurses, as well as medical and traditional circumcision practitioners. Therefore, Dr. Chirwa, is advising those who conduct circumcision to check the hemophilia history of those that are being circumcised.
So I advise healthcare workers, particularly those involved in male circumcision, that it's important to get a thorough history of these boy children to find out, is there any history of bleeding, any previous history of prolonged bleeding following minor injury, or any family history of bleeding in the boy's family, particularly from the maternal side. And that will give you a clue that this patient may have a bleeding disorder, and this you must investigate further before you undergo circumcision or any surgical procedure. So yes, it can be life-threatening, particularly if you have bleeding, for example, in the brain, okay, bleeding in the abdomen. So you may find they may bleed and lose a lot of blood, which may require emergency blood transfusion. So yes, it can be life-threatening.
Walia Simunyolo heads the pharmacy. He assures the people living with the condition that measures have been put in place to ensure adequate and smooth supply of drugs for the condition. Thanks to the World Federation of Hemophilia for the constant supply of drugs to the center.
We've had a fairly steady supply of anti-hemophilia drugs. Of course, it's the factor 8 and 9. We recently engaged the ministry to see how they can help the partners as well, and I'm glad to inform you that a tender was awarded to a company to get us some factor 8, of which we are still awaiting. But we are very grateful to our partners that they were able to chip in just to avert the crisis. So as of now, we have sufficient stocks of factor. Of course, we've already started planning for a replenishment. We actually spoke with the lead person, Mrs. Pikiti, and we've started the process of just doing the quantification.
The foundation is delighted with support from its partners such as Novo Nordisk Hemophilia Foundation, World Federation of Hemophilia, and the Ministry of Health. As the world commemorates this year's Hemophilia Day, remember that people living with this condition are capable of doing anything that any other person can do if they are given the necessary support. Organizations, the corporate world, and individuals are encouraged to come on board and support this noble cause. Remember that together we can conquer hemophilia.